I'm curious about the specific quality standards used for these measurements. Are there defined benchmarks for metrics like A1C levels and blood pressure, such as A1C less than 6.5 and blood pressure less than 120/80, or are the quality standards based on something else entirely?
Another great question, Jason. You've introduced three terms or concepts in your questions. Those terms: one, standards; two, benchmarks; and three, quality standard. Medicare may use these differently regarding quality measurement than they may be used elsewhere or by others. So I'll define each of these three terms relative to Medicare quality reporting. So standards, the term standards, refers to the physiologic number and what it means. It implies a set of agreed upon numbers that represents outcomes. There's measurement, research, judgment, and argument involved in setting these standards, and they're generally set by some kinds of standards, trusted standard setting organization. There are standards for labeling hemoglobin A1C as normal, diabetes in control, diabetes in poor control, or diabetes out of control. Standards, according to the Center for Disease Control: 5.7 is normal, 5.7 to 6.5 is considered pre-diabetic, above 6.5 is diabetes, up to 7 is good control, 9 or above is poor control. A similar scale is applied to systolic and diastolic blood pressures. Each pressure, systolic and diastolic, have standards, differs a bit by the standard setting group, but there are levels that are considered normal, elevated, hypertension, controlled hypertension, and malignant hypertension. Quality measurement could involve establishing the average physiologic measurement across your practice, such as the average blood pressure in my hypertensive patients is 144/86, or the average hemoglobin A1C in my diabetic patients is 8.9, but that's not how it's done in Medicare's quality reporting. Medicare chooses to have us count the patients above or below those certain standard levels. For hypertension, Medicare wants a count of hypertensive patients with blood pressure under 140 systolic and 90 diastolic. They're asking you to calculate what percentage of your hypertensive patients are in good control. This is typical of most measures where higher numbers mean better performance. For diabetes, Medicare wants a count of diabetic patients with a hemoglobin A1C above 9. They are asking essentially how many of your diabetic patients are poorly controlled. It's called an inverse measure, where higher numbers mean worse performance. Now, benchmarks, when used by Medicare in regards to quality measurement, benchmarks describe how your performance rate compares with your peers. It's Medicare's standard for turning your performance rate into a quality score. Benchmarks gives the accurate measurement meaning in context. So if I'm using a yardstick to measure a piece of string or a board, knowing that what I want is let's say a 12-inch measurement, that's my standard for this production. Now I can use that yardstick and put a mark on my bench, and so I can lay the board against those marks and say, well, this one hits the standard, it's my benchmark, and I don't have to convert it to a number and say it's 12 inches or 16 or whatever. So that's essentially the meaning of benchmarks: to step away from the direct number that you're measured and give it direct meaning by comparing it to that standard mark. The quality standard is the specific name of the benchmark that Medicare is using to trigger payment of shared savings or moderation of shared losses. So there is a relationship between the standards, benchmarks, and quality standards, but there are sometimes subtle gradations of meeting. To review, standards in the context of medical quality reporting refers to the translation of science and research onto a scale that uses these measures to predict the health outcomes. Benchmarks relative to CMS quality reporting are the translation of those clinical standard measurements into a standard language that compares effectiveness of the practice. So it can relate a hemoglobin A1C control to blood pressure control and all of the other measurements that Medicare supports. And the quality standard is specific benchmark Medicare has set that above which shared savings are fully shared or shared losses are ameliorated. So I may have just made it more confusing. I hope not. I hope this makes it easier. Thanks, Jason, for the great question.